Hello, everyone. This is Hannah and Riley Heiger. The ethical problem we would like to bring attention to is the implication of delayed euthanasia in wildlife rehabilitation centers. Delayed euthanasia in wildlife rehabilitation is when an animal who is experiencing a negative quality of life with a slim possibility for improvement is not euthanized in a timely manner. According to the American Veterinary Medical Association, when an animal no longer continues to enjoy a good quality of life, the humane thing to do is to give it a good death. This is an issue that we have been more recently introduced to through an internship we had this summer at a small rehabilitation center in northern Wisconsin, which had many difficulties when determining when it was most ethical to euthanize or rehabilitate injured or ill patients. This problem occurred due to being uncertain with the severity of injuries, lack of experience, and lack of reference material and protocols. With this project, we would like to raise awareness to delayed euthanasia in wildlife rehabilitation and suggest the use of a protocol or reference material that would simplify the end-of-life decision-making process for veterinarians and rehabbers. According to the National Wildlife Rehabilitators Association, the goal of rehabilitators is to provide professional care for sick, injured, and orphaned wildlife, with the goal to return them back to their natural habitat. It is also the job of rehabbers and vets to prevent suffering of wildlife by euthanizing patients humanely if they are not releasable due to their injuries or illnesses. Even though the goal of rehabilitation is to release patients back to the wild, its purpose is not only to aid in the conservation of species, but to improve the welfare of individuals who are in need of help. Patient intake. Upon arrival of injured, orphaned, or ill patients at rehab facilities, rehabbers or veterinary staff assess the condition of the patient. Every facility may have a different mode of conducting assessments, but generally the patient will first be assessed for any soft tissue or orthopedic trauma, given fluids, and their temperature will be stabilized. During this assessment, the veterinarian or rehabber will also be determining if the patient would likely benefit from treatment or if they should be euthanized to prevent further suffering. This decision is based on the fact that all rehabilitation centers are restricted by the resources they have at their disposal. Some nonprofit centers are reliant on the generosity of the general public, and others are supported by large organizations or universities, which allow them to have more advanced technology and funds. Facilities with more resources are more capable of treating patients that require more intensive care, while other facilities might not have the means to do so and may have to euthanize these patients instead. For our examples, we are referring to our internship at the Northwoods Wildlife Center, which was a small rehabilitation facility that was dependent on donations from the public and had limited resources. The center's lack of resources and knowledge often led to more cases of delayed euthanasia. 3 examples of this were with a red fox, a bald eagle, and a white-tailed deer fawn. This summer, a female red fox was admitted into the facility with a paralyzed back end and a break at the base of her tail. Over the month that we held her in captivity, we tried different medications and physical therapy to try to improve her condition enough to be released. However, due to a lack of knowledge about her condition and lack of urgency with her case, she was kept in captivity for a month longer than she should have. The fox was euthanized after reaching out to a neurologist from the University of Minnesota's veterinary hospital, who told us that her chance of having a full recovery was slim to none due to not having deep nerve pain. Our second example is of a bald eagle that was admitted to the facility in November of 2019. He had lead poisoning and pelvic nerve damage, which affected his right leg. After treatment, he was able to heal from his lead poisoning, but never gained full strength in his right leg. Due to putting more weight on his left leg, he developed chronic bumblefoot that would not go away despite daily treatment. After 9 months of failed attempts to manage his bumblefoot, the decision to euthanize the eagle was made after consulting a veterinarian at the Raptor Center. This decision took so long because the staff became fond of him and hoped he could become an animal ambassador for educational purposes. Our final example is of a white-tailed deer fawn that came into our facility this summer with head trauma due to what we predicted as a car collision. When he came in, his head was visibly swollen, had several abrasions, and was also not very responsive. But otherwise, he had no obvious terminal injuries. Our rehabbers decided to treat the fawn instead of euthanizing him right away, due to a fawn that they had treated in a previous year who recovered from their head trauma. Treatment for this fawn included medication to manage his pain levels and to reduce the swelling in his head. However, as the days went on, he still was not improving. He would often be passed out on his side, and he would also press his head against the walls, almost as a coping mechanism to alleviate the pressure in his head. After a couple days of monitoring him, we found him dead in his enclosure. Delayed euthanasia is a complicated ethical problem because it is typically not done intentionally and is difficult to prevent. It occurs when the extent of the animal's condition is not known, or if the rehabber veterinarian thinks there is possibility for improvement, but later determines it not possible. Untimely euthanasia can also occur intentionally if the animal's caretakers become too attached to the animal and hope that they can pull through. Also, delayed euthanasia can occur if patients are not properly assessed upon admission. According to Dr. John Hanger, a senior veterinarian, adopting the wait-and-see attitude or attending to the problem in the morning is unethical and poor practice. Similarly, failure to perform a basic examination to detect these potential cases is unethical and poor practice. One of the major ethical concerns with delayed euthanasia is the stress and suffering that animals experience while sitting in captivity. Therefore, euthanasia should be performed when the animal is not experiencing good welfare anymore. That is when they are no longer in good health, have a poor emotional state, and are unable to express natural behaviors. Stress is a huge cause of poor welfare in rehabilitation settings. Wildlife in captivity are subjected to many stressors that are due to abnormal environments, with artificial lighting, unfamiliar scents and sounds, forced proximity to humans, confinement, and restrictions of natural behaviors. These stressors can be so severe for certain species, such as pheasants and other prey animals, that they often don't survive more than a day or two in captivity. These stressors from captivity can also cause long-term effects. Stress can cause loss of weight, decreased reproductivity, and a weakened immune system while animals are in captivity and even after they are released. That is why it's important to weigh the odds of survival of each patient at admission to reduce the suffering experienced due to stress when they're just going to be euthanized in the end anyways. Our target audience are the personnel that admit patients in wildlife rehabilitation centers and the public concerned about wildlife welfare. For example, facilities like Northwoods Wildlife Center, the Raptor Center, and other facilities or organizations from around the country. Our goal of this project is to decrease delayed euthanasia in wildlife rehabilitation by raising awareness of this problem to veterinarians and wildlife rehabbers, along with making protocol or guidelines to assist in the end-of-life decision-making process. We recognize the complexity of this problem and the difficulty of implementing a guideline to be followed across different facilities. As stated by Sarah Du Bois, a professor in the Graduate Animal Science Department at the University of British Columbia, standard protocols and care guidelines exist for some aspects, but some rehabilitators may not access these resources either by circumstance, by being isolated or financially unable to participate, or by choice. Additionally, there are some aspects of rehabilitation where standard care protocols are more difficult to implement, and as a result, practices are left up to judgment of the rehabilitators. Some of the factors implicating euthanasia decisions include caretaker training, availability of protocols, treatment decisions, quality of life assessment, human-animal bond, and economic influences. These factors need to be considered when forming guidelines that are accommodating for different facilities. The guidelines we are proposing may consist of a series of questions for veterinarians or rehabbers to answer as they are assessing the newly admitted patient. Some examples of questions are: does the patient have injuries or illnesses that are treatable? Are there proper personnel or resources available to care for this patient? Is there a good chance for survival? And is there suitable habitat available for the patient if released? In creating a flexible guideline for veterinarians and rehabbers to prevent delayed euthanasia in wildlife rehabilitation, we hope that less animals will have to suffer in captivity just to be euthanized. Thanks for listening.